Everybody poops.
And now that you've had a spinal cord injury, you have to learn how to poop in a different way than you did before.
Managing your bowel movements after a spinal cord injury is very important for your overall health,
It's a topic that's difficult to discuss,
especially for someone who is new to SCI.
but over time it does get easier to both talk about and handle.
Depending on your injury level and function,
You may be able to complete your bowel routine alone, or you might need someone's help.
a bowel program is the method you use for emptying your bowels.
Pooping on a regular schedule really helps make the overall process easier.
Bowel programs can be done in the bed or over a toilet, either suspended from a lift or, for those who can transfer, in a seated position.
The time of day and how often you choose to do your bowel program is up to you.
Some people prefer to go every day, whereas others go every other day or even 3-4 times per week on a set schedule. Over time, you will discover what works best for you.
Inserting a finger or a tool called a dill stick into the rectum will help stimulate the rectal muscles and start a bowel movement.
Some individuals also prefer to use suppositories to help the process along.
Suppositories and digital stimulation are commonly used together to achieve a successful bowel movement.
Some people use mini enemas to empty the bowel. A mini enema can soften and lubricate and draw water into the stool to help stimulate a bowel movement.
It is often advised to avoid using full-size enemas for regular bowel management, as they can irritate the bowel.
But talk to your doctor about any questions you have.
There are also surgical options available for bowel management. Individuals with SCI who have had difficulties managing a bowel program have an option to have an ileostomy or colostomy.
At a basic level, the surgery involves rerouting your intestines to a bag that attaches to your abdomen.
Though it may seem like a radical approach to bowel management, once you learn how to care for your ostomy, many people who have had them are highly satisfied with this method.
As with any surgery, you will want to talk to your doctor to see if this method is right for you.
No matter what kind of bowel program you go with, you will encounter issues at some point. Everyone with a spinal cord injury does.
People with SCI often deal with constipation, and if constipation isn't addressed, it can lead to impaction, where the stool hardens and gets stuck.
Medications such as opioids as well as poor diet can cause hard stool that's difficult to pass.
Drinking plenty of water and eating a diet that includes lots of fruits and vegetables can help.
Ask your doctor if stool softeners or another mild laxative on a daily basis would help things keep moving along. On the flip side, diarrhea can also be a problem and must be addressed quickly, as it can lead to other issues such as dehydration and skin breakdown.
There are several things that can cause rectal bleeding, like overly aggressive digital stimulation, nails that are too long and can nick the rectum wall, and hemorrhoids.
If you experience rectal bleeding, consult with your doctor.
You may need to skip a day of your bowel program to give the area some time to heal.
Whether you perform a regular bowel program or have a colostomy, sometimes there's no avoiding an accident. The best thing that you can do is stay calm. Cleaning up an accident is never fun, but being prepared can make the process easier.
Always keep items like gloves, underpads, baby wipes, toilet paper, plastic bags, a change of clothes, etc. on hand.
If you're often on the go, keep these items in your vehicle or in a bag on your wheelchair. AD can happen in people with injuries at or above T6, and it's considered a medical emergency.
AD can often be triggered from issues with bowel, such as constipation or impaction.
Hemorrhoids, and aggressive digital stimulation.
Keep in mind, everyone's bowel program is individualized.
For some, bowel care can be a reliable routine with just a suppository.
It may take time for you to discover what routine and method is best.
And some methods or routines that might not work well initially may work better as your body becomes more physically stable.
Eating a balanced diet and drinking plenty of water every day will make your bowel movements and therefore your bowel care much easier.